Hello, my name's Christian Marley, or known as Kenny, hence Dr. Kenny here, and I'm based at the Park Dental Clinic. And one of the services we offer at the Park Dental Clinic is treatment of the anxious patient using dental sedation. Now we're blessed today to have Dr. Mudden, who's a consultant anaesthetist at the Royal Derby Hospital, who comes and performs the sedation for us. And we're going to just do a quick interview with Dr. Mudden, and he's going to just go through about sedation. So one of the things is, firstly, how long have you been an anaesthetist?
Oh, thank you, Kenny. I'm Dr. Madan Thirignanam. I'm one of the anesthetic pain consultants at the University Hospital here. I've been an anaesthetist for 23 years, out of which last 10 years we've been here at the University Hospital. Yeah,
okay.
So, yeah.
So you're well experienced in finding veins. Yeah? Now, one of the things sedation is used for is to reduce dental anxiety, and we have a lot of anxious patients.
That's right.
in about dental treatment.
Yeah.
How can sedation help with that?
So, dental phobia is a massive thing. When I do pre-op anesthetic for patients, even at the trust, we see a lot of patients complaining about their phobia towards dental treatments. By giving them sedation, what I mean by sedation is intravenous sedation, conscious sedation. The patients are able to be comfortable and able to access the treatment by our dental colleagues, and they're much more relaxed and they're calm, so that they can have the analgesic local anesthetic injections, and they go very well with the flow. And most of the times the patients don't remember about these because of the various medications which we use. Some patients do remember it, but that's one of the main reasons dental sedation is very, very useful and helpful for the various patients who have dental phobia. You know?
Oh, that's great. Because personally, I know if you're treating a patient and they're already anxious, they're tense, and everything is more difficult when you're tense. Giving an injection in a muscle when you're tense, it's going to be more painful. Whereas if it's relaxed, it's going to be less painful. So having the calm patient, the relaxed patient, the treatment flows much easier, and the treatment is done much quicker. Whereas if you're fighting anxiety, and I'm doing the treatment on an anxious patient, and we're fighting the anxiety, everything takes longer. So having the patient relaxed and calm is utmost important for the treatment to go smoothly. Now, one of the other things is patients don't like is needles, and unfortunately in dentistry they've not invented a way of numbing the patient up without an injection. How would you treat the needle phobic patient?
So that's quite important. So there are various ways to do that. So obviously there's something called pre-medication, where we give some medications for the patients to come into some people even anxious walking through the door, and tend to have fainting episodes and things like that. So we can pre-medicate those patients with medications, so they're much more calmer when they come into the practice. And when they come into the practice, there are various other things. You can put in creams to numb their skin. Those are local anesthetic or numbing solution creams, where we can numb those areas and then use that to access the area, because it's pain-free in that areas. And even some people are scared at looking at the needle, and for them we can give some sedative medication through their nose, where it absorbs quickly into their bloodstream, and they are slightly sedated at that point, where we can quickly pop in a needle. Again, for those patients, we can either use the local anesthetic cream, or we can spray their hand with some coolant or solvent which numbs that area, so we can quickly access the vein and give some intravenous sedation, which is a conscious sedation. So there are various ways available, and to be able to help these dental needle phobic patients who are additionally dental phobic as well. So there are various techniques available, and obviously the staff are well trained at the Park Dental Practice, so they all have a very calming effect, and they know what treatment is coming through, and they're very supportive for the patients, and obviously those help massively in addition to these other techniques which we've talked about.
Thank you, Dr. Mudden.
Thank you, Kenny.
We look forward to helping nervous patients. It's one of my passions, because as a kid I was scared of a dentist, and I hated going to the dentist, even though my stepfather was the dentist. And it's one of the things, I had anxiety going to the dentist as a kid, and I know how it feels. You get that butterflies in the stomach, and you don't sleep that night, you don't eat breakfast that morning, and it's just a horrible feeling to have. So if dental anxiety affects you and it's affecting you accessing dental treatment, come and speak to us at the Park Dental Clinic.
Okay.
Thank you, Doctor.